if you haven't been diagnosed as a child and you're noticing symptoms now, or you've read about what ADHD is or read something about what it could look like in adulthood, I'd say there are definitely tests that can be performed, like psychological tests to check to see if it really is ADHD, which is a really good way to rule out that it's ADHD versus something else. I'd say, getting in with a counselor or a psychiatrist that can do a full assessment, like we were talking about earlier, there's symptoms of other mental health conditions that can overlap, can cause symptoms that mimic ADHD. So you really want to be sure that you have that versus not. Maybe it's something else before you would get started on medication. But there's a lot of good tips and tricks out there for just, behavioral changes and different things you can do in your everyday life if you feel like you have some symptoms that are getting in the way of your functioning that seem like ADHD, right? So if you're getting more distracted or you're having trouble focusing for long periods of time, or you get bored easily and start to daydream, there's definitely a lot of tips and tricks and tools out there that can help for individuals that are struggling with that, and just things you can start incorporating in your day-to-day.